Asthma, we're going to find a lot more over time. I think we're going to learn a lot more about genetics and the way genetics set up people to have asthma. And asthma is much more common than most people think. About 8 to 10% of the population has asthma. In fact, I have asthma myself. And so you have an underlying predisposition to have it, probably there may be some identified gene in the future, and that leads you to have a tendency to have it. Then maybe a cold or a pneumonia or allergies may set you up to having attacks. Essentially, asthma is inflammation or swelling in the airways, the breathing tubes of the lung. So you have a main breathing tube that leads to smaller breathing tubes, and typically there's swelling in the smaller breathing tubes over time, and that leads to three components. You have the swelling part of it, you have the muscles squeezing down, which you have people use the inhalers to relax the muscles to open up their airways so they can breathe better. And the third component is you have a lot of mucus production. So in children, a lot of times these children have recurrent attacks of asthma, but they're thought to be bronchitis because you have a lot of wet, phlegmy cough. They often get diagnosed with bronchitis and get multiple courses of antibiotics when these are truly asthma attacks.